Even though Australia is just recently right out of a lockdown, fears and uncertainties still continue to surround COVID-19, even more so with the announcement of the new variant of concern, Omicron. Here with us today is a special guest, Peter Wark, who has agreed to spend some time with us today in order to answer some questions regarding COVID-19. Peter Wark is a senior staff specialist in Respiratory and Sleep Medicine at John Hunter Hospital, Newcastle, and a conjoint professor with the University of Newcastle. In addition, he is a senior member of the Priority Research Centre for Healthy Lungs and a member of the Vaccines, Immunology, Viruses and Asthma Research Group at the Hunter Medical Research Institute. Hi Peter, thanks for being with us today. And as I mentioned, you're a senior staff specialist respiratory and sleep medicine at John Hunter Hospital, meaning that you're a frontline COVID worker. Many people only believe that COVID is real when they hear it from someone who has had first-hand experience with COVID or has worked with COVID. So how did COVID impact the hospital that you've worked at?
Yes, unfortunately, during the June, July, August, September outbreak that we've experienced here in New South Wales, we have had a number of patients that have required admission to hospital with COVID-19. As you know, across New South Wales, this was a very serious problem. We were averaging over 1,000 patients in hospital beds in metropolitan Sydney and some areas around Sydney on a very regular basis during that time, including people who were extremely unwell, who required treatment in intensive care, and some of them unfortunately remain in hospital and are still recovering from very serious illnesses as well.
So one of the most commonly asked questions we hear around COVID is the question, how is it different to any other sickness? I personally have heard this question so many times, and even now it's as relevant as ever. So how is it different to, say, the common flu? Why should we care about COVID?
So COVID's a viral infection. It's an infection which is transmitted by small viral particles which are present in the air. And from that reason, it's very similar to many other colds and flus and other viruses that are transmitted in that way. The difference with COVID is that it's a new virus for which we've never come across it before. It's previously existed, but it has changed and developed so that now it has moved probably from an animal host to a human host, but it can infect more readily and more easily. And we've seen that as it has been circulating around the world, that it becomes better and better at infecting people and being able to spread in that fashion. And that's the way the virus survives. The fact that we've never come across it before means that we haven't got immunity to it. Our immune system is not used to it. And when we're met with a new virus, it can cause a very serious infection and a serious response for which we don't have any defense. Viruses such as influenza have done similar things to us in the past. And people may remember or have heard about the 1918-1919 influenza pandemic, which was the last very major pandemic that we had, where again, a new type of influenza virus came around, and because we had no immunity to it, millions and millions of people died as a consequence of that.
Thank you so much for explaining that. And one of the reasons that is present with COVID is that there are often some long-term effects. What would you say are some of the long-term effects of COVID?
So that is something that we're beginning to experience now and to find out about. It became very clear with a lot of infections last year that for some people their symptoms would persist for a very long period of time. There are probably two good ways to think about this as a problem. Firstly, it depends on how sick you are with the virus and the infection initially. And if you have a very serious infection, if you have very serious pneumonia that has damaged your lungs or other organs during that first phase or acute phase of the illness, then it is going to take quite some time for you to recover anyway. And we see that with other infections such as pneumonia. If you have had to spend time in intensive care, if you need breathing support, if you've needed a lot of treatments that can cause weakness and difficulties and complications, then people take a lot longer to recover. They'll feel breathless, they'll feel fatigued, and that's something that we see very commonly no matter what serious illness someone might have had. COVID, however, does appear to be unique in that there are a group of people who unfortunately have persistence of their symptoms, and that can last many, many months. We do, for the majority of people, that starts to get better after 1 or 2 months, but if the symptoms are persisting, we start to see a problem, which people are now calling long COVID or long haul COVID. Some people may not have even had very severe disease to get these symptoms. Now, unlike breathlessness and things like that occur in that very acute phase, people who've got these persistent symptoms, while they can complain of breathlessness and chest pain, they often experience symptoms such as fatigue, aches, particularly aches within the muscles. They become very fatigued and feel very unwell after activity, a thing called post-exertional malaise. And some people suffer from problems probably related directly to anxiety and depression. And so this is very common. Some case reports talk about up to 10% or 1 in 10 people who have the infection, even if it wasn't severe, might have these persistent symptoms that are very troublesome. And that can occur at any age. So you don't have to have had severe disease, you don't have to be an older person to have what people are calling long COVID.
So you did also mention just then hospitalizations due to COVID. So for many people, hospitalization and ICU rates are just that, they're just rates. You just hear it on the news like, today we have an X amount of people hospitalized or in the intensive care unit. But if they're, to a lot of people, they're just rates, they're just numbers. But what does it actually mean to be hospitalized with COVID?
So having COVID and developing breathing problems is the most common reason someone will have to go to hospital. We know that the majority of people who contract the illness don't end up going to hospital, but you are more likely to if you are older, particularly over the age of 65, if you're male, and if you have certain illnesses that will increase your risk. Now, the main problem that we see with COVID is that people can develop a type of pneumonia and breathing difficulties. And it's that breathing difficulties and an inability to keep their oxygen levels up that is the main reason that people will need to go to hospital. Being breathless and struggling for breath is very, very unpleasant. And when people are very unwell and require hospitalization, unfortunately, that is a very common part of their symptoms, together with things such as fever, aches and pains, and feeling very generally unwell, just like you would with a very bad case of the flu. But unlike a bad case of just the flu, if you're bad enough and unwell enough to be admitted to hospital, you can develop breathing difficulties that are life-threatening. That can cause damage to your lungs, an inability to maintain your breathing without help, and you need the assistance of breathing machines in order to be able to manage that. On the plus side now in Australia, because we've had a delay in having serious cases here, we've been able to learn about the experience as to how to manage COVID compared to what's happened overseas. And so we do have treatments now that are helpful for people who are unwell enough to be in hospital. Treatments such as dexamethasone and baricitinib, which are tablets that people can receive, and they reduce the risk of ending up and going to intensive care and needing breathing support. We also have some techniques that we can do, making or getting people to lie on their tummy so that they take the pressure off their lungs, can be very helpful in reducing further lung damage. We also can use a machine called a CPAP machine to help provide oxygen and assistance to their breathing as well. And that too can reduce their need to go to intensive care and to require breathing machines. So there are things that we can do, but unfortunately if you're unwell enough to be in hospital, it is still a very unpleasant experience.
I mean, yeah, that definitely sounds quite scary and definitely life-threatening. But unfortunately, one of the reasons why some of the younger generations are not getting the COVID vaccine is that they're under an impression that the COVID symptoms that they will potentially develop are much lighter than the potential vaccine side effects, because they're assuming, oh, I'm young, it will all go through really well, I'd rather just not get vaccinated. So in short, is it better to just get sick and get over it, or is it better to get vaccinated?
It's an interesting question, that. And I guess there's two components to that. So young people can get serious infection from COVID. They can be admitted to hospital and they can die from COVID. They also can get some unexpected complications from COVID, such as inflammation of the heart and clotting problems as well. And then, as we've said, even if you're young, and even if the first time when you have COVID infection, it wasn't that severe or severe enough to put you into hospital, you could still be left with these long COVID symptoms that persist for months and months and months, and that is very unpleasant. Let's compare that to what you might face from having the vaccine. The vaccines are very, very safe. They have few side effects that are long-term or serious. They do, however, fairly commonly cause some short-term side effects, particularly feeling a bit unwell, having aches and pains, and some people even get some fevers as well with them. Now, with the Pfizer vaccine and the Moderna vaccine, the one that younger people are most likely to get, that generally doesn't happen with the first dose, but it does happen more frequently with the second dose. That's unpleasant. Those symptoms go away within 24 hours and you're back to your usual self. Most people don't need to take time off work. They don't even need to take a Panadol. The risks of more serious side effects, well, they are possible, but they are extremely rare. Less than 4 in every 100,000 people who receive the vaccine can develop more serious problems such as irritation and inflammation of the muscles of the heart. But you've got to remember, we've now given about 7.8 billion doses of COVID-19 vaccines around the world, and the outcomes are so much better. The other reason, though, of course, is that while you may not end up in hospital and you may not die from COVID, having the vaccine will stop that spreading to someone who is more vulnerable and who is more susceptible to getting COVID and becoming unwell and ending up in hospital. That might be your relative, that might be your next door neighbour. And we also know very clearly that having the vaccine, not only does it reduce your chance of being admitted to hospital nearly tenfold, but it reduces your chance of feeling sick, and it reduces your chance nearly sixfold of spreading it to another person. So it's about protecting yourself, but it's also about protecting the rest of society, people who are susceptible, children who at this stage can't get vaccinated. The more people that are vaccinated in our community, that means the more protection that we will have to prevent this from getting any worse. And so if everybody is vaccinated, that will protect more people. Unfortunately, having the infection itself may not offer as good a protection as being vaccinated. And we've seen that in countries like Brazil, where new variants emerge, and in fact people have probably got less protection from having their natural infection compared to having their vaccine. And so vaccination is certainly the safest and the most effective way of reducing spread to somebody else and to minimize your chance of getting serious infection as well.
And that's definitely really important. We're nearly at the 95% vaccination mark. And finishing up with everything you said, everything you mentioned, will COVID be just the new normal, something we just have to learn how to live with?
Look, unfortunately, none of us know what's going to happen. It's pretty clear now that COVID-19 is not going to go away. As we've seen with the emergence of a new variant, Omicron, in the last few days in South Africa, the virus continues to change and continues to be challenging. We don't know what implications that will have yet, but it's clearly still an active issue. I think the best thing that we can do is, if we have high levels of vaccination, and then in 6 months after people have had their first course, they are going to need a third or a booster dose. Hopefully from then on, we'll have enough people vaccinated that that's going to protect us. It will mean that our hospitals are not under strain and are not getting too many people coming in, that we're not seeing as many deaths, and that we'll have enough protection in our community that life can return somewhat to a more normal way. We're probably going to have some protections in place in the short term though, mask wearing, social distancing, and it's almost certain that there will still be some outbreaks as well. So I think there's still many things to do, and unfortunately this problem is just not going to go away quickly. We've been fortunate here in Australia that it has not caused as many deaths and as much damage and destruction as what we've seen elsewhere. But that's not to say that people haven't struggled. The lockdowns have been very hard. The changes to our lifestyles have impacted on all of us, and people have found that as being extremely difficult. And so I think we've done a good job. Hopefully things will be a bit better, but we still have a way to go yet, I'm afraid.
But I think we're also doing, as much as we can in keeping ourselves and the community safe. So yes, thank you very much for that. Look, thank you so much for your time, Peter. We will also be adding a link to your articles that you've written. I've had a read through them. They are honestly so easy to follow, absolute gems. And I think other people should have a read of them as well. So thank you. Yeah, thank you very much for being with us today. We're so thankful that you've been with us today and explained all the questions I had to you today.
All right. Thank you, Sofia.
Thank you. Have a good one.